3 Cokes, thanks.
Right, well, it's table service, so I'll bring them over.
Well, we're outside.
Well, I'll bring them out to you then. Where are you sitting?
Oh, I don't know yet. So I may as well just take them.
Whatever. Right. Tap and go.
Hang on, hon.
What's with all the yelling?
Sorry, another round, please.
No luck with the darts, then?
Oh, is this the saddest stag do you've ever seen?
Might just be.
That bad? No, do you know what? I've still got a few more hours to turn it around.
How?
Well, I've got a few tricks up my desperate sleeve.
Good afternoon. The Ministry of Health will update us shortly on the 3 new community COVID-19 cases that have been linked to Auckland's Papatoetoe High School. An infant sibling, along with a Kmart worker, a teenage sister of the college student who tested positive yesterday morning, is one of the new COVID cases revealed last night. 31 of her Kmart co-workers are now also in isolation. All right, while we await Health Minister Chris Hipkins and the Director General of Health, Dr. Ashley Bloomfield, let's go to our political editor, Jessica Mackay. Kia ora, Jess. Dr. Bloomfield was on breakfast earlier today. He didn't seem too concerned about the latest cases.
No, I think we've heard from him a lot over the last few months, and you didn't get a sense that he was particularly anxious today. So hopefully nothing has developed over the last few hours between then and now. In terms of those updates, of course, we did get those new cases through just before 7 p.m. last night. The siblings linked to the students at Papatoetoe High School, and of course one of them did work at Kmart in Botany. Now, in terms of the people who visited the store, anyone who was there on the 19th and 20th of February, the particular times can be looked up on the Ministry of Health website. They've been given instructions, as well as those 31 Kmart workers who worked alongside the person. They are self-isolating at the moment. So some more places of interest have come out of these recent cases. In terms of the testing stations today, those close to that South Auckland, East Auckland area have been a lot busier today as people go in to be tested or retested. And there's also been a very clear message from Dr. Ashley Bloomfield this morning that anyone linked to the Papatoetoe High School households, they need to stay at home, they need to not go to work, not go to the supermarket, not go out to visit anyone. It's very important that they are self-isolating. So that message emphasised for them today. We will be waiting for more information, of course, from Dr. Ashley Bloomfield and Minister Chris Hipkins. They are due to speak at 1 o'clock, just running a couple of minutes late at the moment, but we'll keep you updated as soon as they do get here.
Yeah, of course, we will be hearing more about testing, but we're also expecting an update on the vaccine rollout. How has it been going?
Yeah, that's right. We started vaccinating people about 5 days ago now, and so it is in full swing. It's not just in Auckland, the border workers, it's also in Wellington and Christchurch this morning. There were about 40 frontline staff in Christchurch that have been vaccinated, so that very much is in train. And we have had that first batch of Pfizer vaccines, and we'll be waiting to see if there's any update around vaccines and vaccine rollout from the press conference today. One interesting thing I did note in reports out of the US today were that the US authorities are now saying that the Pfizer vaccine, which is the one we have here in New Zealand, doesn't now need to be kept in an ultra cold freezer, so a special freezer that we've got ordered. They're now saying it can just be kept in a regular freezer, and this would make a big difference for the rollout because it means you don't have to have those special freezers shipped to various places. You can just use freezers that are there and hand already. So I'm sure that is an important development that we will be looking into as well. Now, they are just moving into the theaterette now to give us an update on the situation and how everything goes. I think there are some questions, obviously, about the new case numbers, whether we've had any positive cases over the last few hours, but also how ring-fenced some of those locations of interest are. So I think there will be lots of questions for them today. Let's take a listen.
Good afternoon, everybody. Today I'll give you an update. We'll give you an update on the cases and the vaccines. Getting to some good news first. We have no further community cases of COVID-19 to report at this point. Testing's going well. At least half of the Papatoetoe High School community has already been retested. Those results that are in have all been negative, and we have some further results pending. The final small group who were outstanding from the first round of testing are being actively followed up. Every effort's being made to ensure that they get their test and that they remain in isolation for the full 14 days. Overall, the school community is responding extremely well, and again, I want to thank them for their patience and the leadership that has been shown throughout here. Nobody invites COVID-19 into their community, but when that happens and a community responds as positively as this one has, it certainly helps in our overall response. So I'll give you an update on vaccine rollout shortly, but first I'll hand over to the Director General of Health for a bit more information on today's update.
Thanks, Minister. Kia ora koutou katoa. So, as the Minister said, our numbers today are, thankfully, very much business as usual. There are the 2 new cases in managed isolation. One of those is an historical case, and we have no new cases in the community. All the regular information is about to go up on our website, including about the 2 positive cases that are siblings linked to Case I that we did talk about yesterday evening. Yesterday's news of additional cases, I know, was unsettling. Feels like another climb up on our roller coaster ride, but it does not need to be alarming. I'm confident the system is working as it should under Alert Level 1, and there is indeed a lot of work underway. Of course, our very close monitoring, our ongoing follow-up of any of our contacts who are in isolation will continue. So there are now 11 cases associated with this cluster, and all these cases are in the Auckland quarantine facility. We can confirm the genome testing for Case I, which was the first case we announced yesterday, has shown to be the B117 variant and very closely related to the genome sequence for our first cases A and B, that had an identical, those 2 cases had identical sequences, and this one is very closely related. This is what we expected, and it does provide reassurance that the cases yesterday have not appeared in the community at random. There is not another source of infection here. So both cases A, the original schoolgirl, and I yesterday are genomically linked. Both are students at Papatoetoe High School, and both were at school on the 10th of February. We haven't established the exact transmission link between the 2, but it is likely to have occurred in a common area such as a bathroom or corridor. We do appreciate there is a lot for people to absorb around these latest cases, and we are continuing to make information available as quickly as possible and as clearly as possible. All the current information about what people need to do within the different categories of contacts is being published and regularly updated on the Ministry of Health website on the Locations of Interest page. This is something of a one-stop shop for people who may have been at those locations of interest, and includes clear instructions about what is expected of them. And of course, Healthline also has that information. So moving to the wider outbreak, you might recall that our contact tracing had previously identified a total of 126 close contacts associated with the 2 previous households, which were cases A to H. All these contacts have now returned negative tests, except for 3 who have not been tested. 2 of these are children, young children who are not required to be tested, and others in their households have returned negative tests. There is 1 contact from the medical clinic we have not yet been able to track down, but will continue to follow up with. That was considered a low-risk exposure event. Of the 1,496 casual plus contacts from Papatoetoe High School initially from the 10th of February, 1,487 have returned at least one negative test, and I can say there were over 600 students and staff tested yesterday, and already 328 tested today back at the college, so getting through those second tests very quickly. Those who have all had a test have returned negative test results, except for three close contacts who have not been tested. Sorry, there are 3 positive cases, which are our cases E, I and J. Otherwise, everyone has had 1 negative test. There are 6 students who have not been tested. These are all being actively followed up and contact made, including visits to the household. For yesterday's cases, I, J and K, there have only been 4 close contacts identified outside the household so far. 874 people have phoned Healthline, indicating they were present at one of the locations of interest and at the relevant dates and times. And in this particular instance, as we've talked about, we are being especially cautious and are managing these people, even though they are not close contacts, we are managing them as if they were close contacts. So they will be required to stay at home for the full 14-day period and be tested at day 5 and then day 12, and they will receive daily follow-up from our public health units and others. Our national contact tracing systems are in action. Indeed, our wider public health units around the country are helping out with this follow-up of these people as well. It's a very active process, and if necessary, visits to houses are made to ensure people have the support they need to remain isolated and to access testing. There are plenty of community testing centres available around Auckland as usual. Those closest to the locations of interest are in Botany, Otara and Wiri. I understand there were some queues there this morning, so reminder that there are other sites people can go to, and also many GPs and urgent care clinics can test, and testing is free wherever you have it done. And finally, just perhaps a word on variants. We're actively monitoring the emerging evidence about these new variants from overseas, including around infectiousness, incubation periods, and symptom presentation. There are questions around, of course, that have been raised here about why some very close contacts don't seem to be infected, but in this instance we've had what appears to be a very casual interaction that has led to an infection. Of course, this is seems to be the nature of this virus, and particularly these new variants, so we'll be following that evidence up very closely. And I just want to emphasise too that several of our recent cases with this new variant have had what one might call atypical symptoms, where their main symptom has been muscle aches and feeling tired rather than typical respiratory symptoms. So I do want people to be aware of that. Sometimes people ascribe these symptoms to other things, such as post-exercise muscle discomfort, sore muscles. So if people could just keep that in mind. And in several of these latest cases, the students have not felt particularly unwell or have understandably ascribed their symptoms to something else. Wastewater testing continues around Auckland, and all of that so far is negative, aside from the positive tests we frequently get for the pipe that is draining out the jet park, as we would expect, and that acts as a bit of a baseline comparison. Around alert level changes, I know there will be a lot of interest in that. I've formally sought advice from Dr. Ian Town, the Chief Science Advisor at the Ministry, and Dr. Caroline McElnay, the Director of Public Health, both last night, and we talked again this morning, and we don't see any need in the current situation to advise around raising the alert levels. It's not dissimilar to the Northland situation we had several weeks ago, with a large number of places of interest that we successfully were able to follow up, isolate and test people to get ahead of it. Thanks, Minister.
Thank you, Dr. Bloomfield. A quick update on vaccines before we get into questions. We've seen vaccinations begin this week in Auckland and Wellington, and today the first 40 border workers at Christchurch International Airport were the first in the South Island to receive their vaccinations. This passes a milestone for us, the first 1,000 New Zealanders receiving their first dose of the COVID-19 vaccine. That's a good start, and I want to extend my thanks and appreciation to the vaccinators officers and the border workers that have been involved in this effort so far. They've included aviation security workers, cleaners, police, customs workers and health protection officers who are screening passengers as they arrive on international flights. It's good to see the gradual scale up of vaccines being administered amongst this Tier 1 group as we had planned. As the process at each site is fine-tuned, we expect to see the numbers of people vaccinated each day slowly starting to increase. Further good news today, I can report that we've received a further 76,000 doses of the Pfizer vaccine. They were flown to New Zealand yesterday, and as with the first shipment, they are now undergoing quality assurance and checks by MedSafe. By the end of March, we're due to receive a total of around 450,000 doses, which will be enough to vaccinate 225,000 people with the 2-dose course. I can also confirm that we received a shipment of 490,000 special purpose needles that arrived into New Zealand yesterday. These will help the vaccination teams maximise the safe use of the vaccine. Making the most out of every vial of vaccine and avoiding any wastage will help us to ensure the successful rollout of our immunisation program. So happy to open up for questions.
Have there been any problems with, you talk about the quality checks there, have there been any problems or wastage of any vaccines that have come through the country yet?
Not that it's been reported to me. One of the areas of focus for us has been making sure we can get the full 6 doses out of each vial. My understanding is that they have been able to do that. There haven't been any concerns around certainly there were no problems in getting the vaccines to New Zealand. The shipment process went very, very smoothly. All those safety and quality checks happened very smoothly as well.
Pretty quickly with the Pfizer vaccine, is there any expectation that the other vaccines scheduled for later in the year will come earlier?
We'll have more to say about that when we can. Obviously, they're going through an approvals process as well. I'm just not in a position to be able to update you on the likely arrival of those of additional vaccines. I can tell you what that the Pfizer, the 750,000 courses of Pfizer, we're expecting to be spread across the first 3 quarters of the year, and so we're on track to be able to get our first quarter shipment in by the end of the first quarter. As I've indicated, it will come in smaller waves. In terms of the other vaccines, when we weren't expecting any of the other vaccines in the first quarter, when we're in a position to update on that, we certainly will do so.
On the topic of the Pfizer vaccine, there have been reports out of the US, and perhaps this is a question for Dr. Ashley Bloomfield, that now the Pfizer vaccine doesn't have to be stored in an ultra-cold freezer, it can just be a standard freezer. Is this something we're looking into? Because the implications of that would be pretty big for us, wouldn't it?
Yes, I have heard that they think it could be stored at a lower temperature rather than ultra-cold. However, the important thing is whichever very low temperature it's stored at, once it is taken out and thawed, it needs to be used within 5 days, and that's the more critical thing in terms of the logistics and the planning of the vaccination. So whether it can be stored at -70, and we have now got the freezers and the capacity to do that, or a slightly warmer temperature is probably less of an issue than just this 5-day constraint on once they're thawed.
One of the advantages of the approach we've been able to take with Pfizer is by having vaccines arriving in the smaller amounts, we actually end up having less stockpiled in our freezers. And as we scale up the campaign, if we can continue that approach with them, and we'll keep talking to them about their delivery schedules, then obviously that works to our advantage as well as to theirs.
Can I ask you about this leave support scheme that's being supplied? There's now a really large group of people that are the casual plus contacts, and for them staying at home for 2 weeks is a big deal. Having only $580 for a fortnight, that just doesn't seem enough for a larger group of people. Is that something you're looking at now that those numbers are bigger than usual?
Look, we're always looking at how we can improve support, and that's not an area that I particularly have responsibility for. My ministerial colleagues will be able to comment more on that. But what I would say is, as we've been clear from the beginning of our COVID-19 response, we are never going to be able to compensate everybody for every eventuality, for every cost that they may incur as a result of our COVID-19 response. We do work a bit on a cost share model to try and help people through adverse situations, and clearly for this group of people there will be some people who will be adversely affected by it.
Can you see when you're scaling up and asking people to stay at home for 2 weeks, which is more than what people are usually required to do in these circumstances, that they will find if they can't go to work, they can't work part-time, they can't do their full-time job? That's a big deal.
So we're also asking employers to be supportive as well. In my own engagement with the business community, I found the business community very receptive to that. They would rather be supporting smaller groups of people to stay at home than experiencing broader restrictions, which is of course one of the alternatives. So generally speaking, my message to employers is please do your bit as well to make sure we're supporting these people so that they can do the right thing by staying home.
On the investigation into these new cases, have you nailed down the fact that these 11 people weren't contacted by Monday and might have been contacted now? What efforts were made by the contact tracing team? Was that just ringing repeatedly, or were there, door-to-door visits? Was there not an address not held by the school that you couldn't find? What was the kind of point of failure there?
So I don't think there was a point of failure. There were repeated efforts, and I've seen, for example, for this family, the log of all the calls made to both the home and the students themselves, and the challenge that there wasn't any communication established. So saying, they clearly understood that, or the student who clearly understood that she needed to be tested before she went back to school and was tested on Monday. There is also, if I look across that group, a number of them have been contacted, but still not gone out for testing. And so for some Māori or Pacific providers have already been out and worked with the family. The key thing we want to be sure about is that those students were isolating, they weren't going back to school without a test, and for those who are having trouble accessing testing, that was being supported. And for example, there are 5 who haven't had a test yet, 4 who are being tested today.
Sorry, were there any visits, or was it only phone calls?
My understanding is there weren't any visits done before the end of the weekend, but that of course is now happening.
And you said that they knew that they needed to be tested before they came back to school, but am I not wrong? They got tested when they were sort of symptomatic, and they went to a community testing centre, not the school's testing centre. What if that suggests that they were just saying the wider COVID advice about getting tested when you develop symptoms, rather than specifically the school advice?
Yeah, I mean, there may have been reasons why they couldn't get to testing, remembering that the youngest student here was only 13. She may have been reliant on other family members to get her to testing. The important thing here is we had put in place a protocol where no student could or staff member could return to school without a negative test. Between 98 and 99% of those people had been tested, and we had results back by Monday. There was a small group at the end, and they are now being very actively followed up.
It's pretty bad luck that tiny group, that 1% had a positive case.
Well, you could say it was bad luck, but also, again, the thing about you can't rely on luck with this virus. That's why we had the protocol in, not returning to school unless they had had a negative test, and that's transpired to be exactly the right thing to have done.
Has any thought been given to vaccinating the school community as a priority?
No, not at this point. We're obviously looking at risk, and we're looking at the rollout of our vaccine, focusing on those most at risk, settings that are most at risk. Now, as we get up into a position where we're where there's a wider availability of vaccines, but perhaps before we get to the point where they're available to everyone, we will consider whether educational settings need to be thought about. We're not at that point yet. We're still very much focused on our border workers and our most at-risk frontline workers. There may be, another group between then and when we get to everybody having it, which we think about.
But this cluster doesn't meet the urgent vaccination criteria in the strategy?
No.
What's with 225,000 vaccines available by the end of March, who's the next category of people to be vaccinated after border workers and their household contacts? And will the sort of program immediately roll on to vaccinating those people, or will there be a sort of pause while you sort of recalibrate?
So look, the goal obviously is to keep scaling up the vaccination program. So we want to make decisions as we're going along, and as I've indicated before, decisions about who we bring in when is partly driven by how many many vaccines we have available to make sure that we can keep that forward momentum going. But it will include other frontline health workers, such as those who are doing testing, those who are working in health settings where they're going to have people coming through the door and be interacting regularly with people. It'll potentially include aged care. So we'll have more information on that closer to when we start to roll out to those additional groups.
And what's special about the new needles that have been imported? Is it that they have less dead space in them, and are they reusable or single use?
I'll ask Dr. Bloomfield to comment on that.
Yes, so these are what's called low residual volume syringes and needles. Interestingly, though, right from the start, our nurses have been able to get 6 doses out of in most instances, out of these 5-dose vials, even with regular needles and syringes, and they worked out right from the start a technique to do that, which is to actually invert the bottle, so there was no gas getting in, being drawn up into the. If you get air bubbles, then you have to go through this procedure. So it's both quicker, and it means in most instances they are already getting 6 doses out of each vial. The low residual volume syringes and needles will make that, almost guarantee that we'll be able to do that each time.
Luke,
Dr. Bloomfield. Case J, do we know exactly what jobs they were doing at Kmart?
Yes, we have a good idea there. So for most of the time that she was at work, she was folding clothes in the men's and women's clothing areas. On one day, she was out the front counting people going in, and we're checking, but we're assuming that that's as part of having a restriction on the number of people who were in the store at any one time. And the other task that she was doing on one of the days was click and collect, providing click and collect products to people, and that involved a very short, more face-to-face interaction with some customers coming in. But importantly, those are people that we can trace because they'll be recorded on the click and collect.
So the counting job, was that just sort of with the clicker counting people going? That was greeting people at the door?
That was counting people as they came in.
Are you concerned about getting some false negatives from Kmart customers who are rushing out to get a test today rather than waiting till tomorrow?
Yes, so I'm not concerned about it, but the testing is that first test should ideally be at least 5 days since the last exposure, and then we do another one at day 12 anyway. And as I said, in this instance, we are taking this very cautious approach of isolating them for the full 14 days. So even if that first test may have been a little premature, they will still be isolated and still require that follow-up test anyway.
And do you know what Kmart's doing to sort of manage the store or staff or making sure that it's safe to be open?
I don't know exactly. I did read that the store was open again. Presumably they've got quite a pool of staff they can draw on who aren't isolated as close contacts. I'm very confident that they would have gone through a cleaning process as well overnight before they reopened.
What about those students at the school? They're obviously facing the second week of disruption of the school being closed. Do you anticipate much of disruption to their learning, and what are you doing about it?
I know that with the lockdown, the alert level escalation, the school already had kicked into their remote learning settings, which most schools around the country have mastered as a result of our experience last year. While it's not ideal, it does allow young people to continue to learn from home. So I'm confident that the school will be doing everything they can to support those young people.
And just on a different topic, on the asking people to isolate, is there any means that you're looking at of sort of ensuring that is happening? Sort of at the very beginning of the outbreak, we had, the police texts that would go out to sort of ensure people were where they said they were. Are you sort of re-looking at those tactics again?
Look, I haven't received any specific advice on that. As with all things, we obviously ask people to do the right thing here and to isolate when they're asked to isolate. They're being asked to isolate for a reason, and we need people to follow the rules. It's the way we avoid widespread community spread, and it's the way we avoid having to take more drastic measures. So we do want people to do the right thing.
Yep, the protocol will be this time and has been for some time because they're being treated as close contacts, and this is what's creating, because it's a big group, quite a lot of extra work, and why we're involving all the public health units around the country, because they receive daily phone calls, and if they're symptomatic at all, then that requires a nurse to inquire about the symptoms and just check and see whether that requires additional testing as well.
We'll come up the back.
All right, that's where we'll leave the press conference today. If you want to watch the rest of the question and answer session there, head over to our website, onenews.co.nz. Choose the top video, click play, and then press live on the menu bar. That way you won't have to watch from the very beginning. All right, here are the main points from this afternoon's briefings. There are no new community COVID-19 cases for today. The 3 cases confirmed yesterday are unsettling but not alarming, according to the Director General of Health. 874 people have rung Healthline to report they were at a place of interest. They'll be required now to self-isolate and to also be retested. And vaccinations in New Zealand have passed the 1,000 mark after 40 Christchurch airport workers received the dose. And another 76,000 vaccinations have just arrived in the country. Ashley Yates joins us now from the Botany Downs testing station in East Auckland. Kia ora, Ashley. Tell us what the testing numbers out there are like today.
Good afternoon, Simon. Well, cars are bumper to bumper full of people waiting to get tested. And if you come with me, there's also another testing station located about 100 metres down the road at the Super Clinic Health Centre. This comes after that confirmed case yesterday. A sibling works at Kmart, which is just located at one of the main shopping centres down here in Botany. If you visited that store between the 19th and the 20th of February, between 3:30 p.m. and 10:30 p.m, you are being advised to self-isolate for 14 days and to get 2 COVID-19 tests. Another place of interest was Dark Vapes in East Tamaki. Again, if you visited this location between the 19th and the 20th of February, those times can also be found on the Ministry of Health website. Those potential exposure times, you too are also asked to isolate for 14 days and also receive 2 tests. Hundreds of families are going to be affected here, Simon, especially because the Kmart store here is very busy and a lot of people visit that store.
Yes, indeed. Thank you for that, Ashley. 874 people, of course, identified as close contacts. That's Ashley Yates at the Botany Downs testing station. All right, what we do know, of course, we now have 11 cases in this cluster. They are all now in isolation at the Jet Park quarantine facility, very closely linked by genomic sequencing, so we can be somewhat satisfied there is no other source of infection, according to Dr. Ashley Bloomfield. The cases I, J and K, they're known. Case J is the sibling who was identified just before 7 o'clock last night as a Kmart worker at Botany Downs who mostly spent her time folding clothes, and one day she was counting people going in and was also briefly involved in a click and collect role with face-to-face with customers who are easily traceable as a result. All right, thank you for joining us for this One News special. We will, of course, be back with full and comprehensive coverage on the One News Hour at 6. In the meantime, have a good afternoon.
Nice. TVNZ On Demand is the place that likes to make life simple. Want big shows on a big screen? It's yours. Want to watch on a smart TV? It's yours. Take your pick. Want to plug a PlayStation, Xbox, Apple TV, Vodafone TV or Chromecast into the biggest screen you can find? It's yours. However big you want it, here at TVNZ On Demand, now that's big.